Hello friends, welcome to this week's Milk Minute. I'm Sara, the lactation consultant, IBCLC here at Health Foundation's Birth Center and Women's Health Clinic. This week's topic is how milk happens. So the process of lactogenesis, which means the process of making milk, actually starts in the second trimester, and that's when the body starts to produce the first milk, which is called colostrum. And then what happens is the birth of the placenta, right after you give birth to your baby, initiates a really sharp decrease in progesterone production. And the decrease in progesterone in the presence of the prolactin that your body is making at that time signals your body to start making and creating mature milk. And what that means is that the colostrum turns into what we would consider and what we would recognize as milk in those first 3 days. So colostrum is usually a clear to a yellowish, thicker, stickier substance. And in those first couple of days after life, it turns into that more white colored consistency of milk that we're used to seeing. And the next process is that at about 30 to 50 hours after the birth of the placenta and the birth of the baby, the milk starts to change again, and it starts to come in more fully. So this is usually called the milk coming in, and at that time breasts start to feel heavier, more full, they may leak. And at this time, milk is still pretty much controlled by this hormonal response in the body. It's also very important to have babies nurse very early and very often, so that as that hormonal control of milk starts to decrease, the baby has gotten really efficient at removing milk from the breast, because the next period of how milk is made is reliant on supply and demand. So that means that the more milk that is removed from the breast, the more milk your body will make to replace it. And that is a very intricate process that involves how much your baby needs, how well your baby's doing. Your breasts will refill at a rate that's different for each person, because the capacity of each breast to hold and create milk is different. So it's a very personalized process. The main points I want you to take away with you today is that in the beginning, milk is made because it is hormonally driven, and that in those first few weeks and months, it turns into a supply and demand driven system that is really based on how much milk is removed from the breast, so how often baby's nursing and that breast is emptied.